Hey, this is Renew Education. We're looking at one I'm going to call the Great Starter. The reason why, if this is your first time placing implants, this is it. This is gives me this is just such a great case. When I teach doctors placing implants, definitely one of those positives in terms of the bone quality, the shape of the bone. The position of the tooth replacement, and this is just such a great starter. Let's look at the treatment assessment. The treatment assessment says a green facial bone, green bone density, green constriction, light green IA nerve, and green sinus. The only yellows I would kind of put in there were yellow chew pattern and the yellow failing front teeth. He's got a bit of wear and tear here, a little bit of erosion going on in these teeth here. But the only concern here, and this is something clinically you have to look at, is how wide you actually have up here in the upper left area between the premolar and the molar. So getting something in there could be a little bit trickier than it seems. And also restoratively, this tooth is kind of in this weird arch place, so it's kind of like, where does this crossbitey kind of weird spot go in terms of restoring it? But it doesn't matter. Let's look at number 4 right here and get a closer look at that here. So, all right, so here we go. Look at the sinus. Can't even see it. Look at how much good bone there is, and it's just a premolar site, so that's crazy good. Let's see here. All right, so that's our implant here. Here's the pano view of it. Here's the other implants. But yeah, this looks super great, very straightforward. If you want to do a flapless surgery here, no problem. That wouldn't be a big deal. You have your guidance on the mesodistal direction. You have just so much bone to work with. You're just looking at where you're going to get occlusal load. You can put a pin in and just kind of register with an x-ray about how your angulation is going on that osteotomy. So that's about it on number 4. Let's look over here on the other side. This is just as good. Look how wide that bone is. Look at there. We just start to see the sinus. I usually don't place anything more than an 11.5. This is an 11.5 by 4.2, so that's totally fine. Like I said, some of my drills are a little bit wider at the neck because they stop at the tissue height. So I would have a little bit of an issue trying to get those drills in there. With this much generosity, you could use those straight, twist drills that you get from like a Implant Direct setup or possibly the older Zimmer setups. I don't know what the new Zimmer setups look like. But the basic ones that have the lines and the stripes in it, doesn't have any kind of stoppage at all. They're just a straight twist drill. And the bottom here, let's see, no, we are not there. Let's see, over here. There we go. So here's number 19. Lots and lots of bone. Don't have to worry about that. And you're looking at a 5 here. If you have an opportunity to do something bigger, then maybe do that. If you get a 6, I would probably think about doing a 6mm implant, diameter implant here. You could even get away with a 7 probably in that area. You're just going to start to collapse your occlusion here where you're trying to get that in. But this is such a great starter case. Nothing else really too much to worry about. Some general dentistry may be in there. But if you're going to pick a starter case and pick somebody that maybe even you want to do a pro bono case on, that you feel like, hey, I'm starting, I'm learning, this is your slam dunk case. You're going to be very successful with this one. So like all other starters and all these green light kind of cases that are out there, there's not a whole lot to talk about on those cases. So that's kind of where we're at. So anyway, stay tuned. Go to our websites, check it out. Check out our live stream when we get check for times off the websites. But like us on Facebook and subscribe to us on our YouTube channel. Thank you.